Good evening. My name is Rama Murthy. My father-in-law, Kesan Murthy, was admitted on 2nd November in this Medicover Hospital. He has got a blood clot in the cerebellum, which Dr. Matsudan referred to this hospital. As a physician, he is treated, and then he suggested me to Dr. Dalai, a very known doctor in the city. Dr. Matsudan has briefly told me about this doctor. Very few doctors, what I heard, who can do this stunts very easily and without any disturbance in the surgeries. In that way, I was connected to this doctor on 2nd November. When I first met him, I was so much impressed. The 2 minutes discussion with the doctor made me very much comfortable, and I've told my family and my father-in-law that we should get this stunts done in Medicover under the guidance of Dr. Dalai. When this carotid artery disease, he explained me very nicely. When on the Saturday, when he has done the surgery, once the surgery is over, he called me to his office and explained me before and after. When angiogram is being done, he explained me in a very, very detailed manner. And at the same time, in the right side, the stunt is being done, also explained me the before and after. And the way he explained, I really liked it. And the patient also never complained about any particular side effects or any kind of pain, or he really undergone the procedure very well. And on Monday, we have done the left side. Both stunts have been done with his experience in a very, very esteemed manner, which my father-in-law till today has never said to me about not even 1% about the surgery's difficulties. And the staff, the management and the staff, and down the line, very nicely being taken care. And everybody has shown a lot of interest to help each other and done a fantastic job. Today, I'm going in a very, very happy manner. I really like this hospital. I really like the doctor and the management. And I will definitely encourage this. And I'm going to explain, or rather anybody who's asking me, I should recommend this hospital and the doctor also. Thank you for giving me an opportunity for doing this. Thank you.
We have this gentleman coming to us with multiple episodes of TIA. TIA is transient ischemic stroke, which is otherwise known as mini stroke in a common man's language. So what is a mini stroke? Basically, stroke is a disease, is a condition where suddenly the blood vessels into the brain gets occluded or ruptured. Hence, the blood supply to the brain is restricted. Generally, the patient present to us with a drooping of the eyelid or the face, or paralysis of one side of the body. But there is a condition called mini stroke. That means it's a short stroke. In medical language, we call it as a transient ischemic attack. In this, the patient experiences a stroke, but that's generally for a few seconds. So that is called a mini stroke. So our patient, Mr. Murthy, had multiple episodes of transient ischemic attack or mini stroke. For our information, I want to say that mini stroke means the patient might have a weakness which he may recover from that weakness within about 10 to 20 seconds. Or the patient can have sudden blindness, and from that the patient might recover with about 30-40 seconds. So he had a stroke, but he came back and he got normal. That is called a mini stroke or transient ischemic attack. So Mr. Murthy had multiple episodes of TI in both cerebral circulation, and he was examined and treated by our neurophysician, and then the patient was referred to me for further evaluation of the vascular situation in the neck and the brain. So when we saw the patient, we found that he has very significant stenosis in both carotid artery. So once the carotid artery, which is the primary supply of the brain, that comes from the heart through the neck, on the one on the right, one on the left, they go into the brain. And once this carotid artery gets diseased, the blood supply to the brain comes down, and some of the clot or the plaque from this carotid might just go up and occlude a small little vessel in the brain, which can give rise to these symptoms like TIA. Especially the visual TIAs are mostly because of carotid artery disease, and once the patient is having sudden blindness and is recovering from that, which is called amaurosis fugax, or in common language we say it's a mini stroke affecting the vision, then we suspect carotid artery disease. And we found both carotid artery disease were diseased significantly, hence we decided to treat both carotid arteries. And we don't do carotid stenting of both sides at the same sitting. So we treated one carotid artery on Saturday by carotid artery stenting with distal embolic protection, and he did fantastically well. On Monday we treated the other side, and today is Wednesday. He's going home happy. He's absolutely fine, and we are very glad to have him here and treated him completely. He's going back home. Thank you very much.